Okay.
Yeah.
My name is Cindy Mulhall, and I'm one of the case managers for the acute MI, and I job share my job with Barb Major. We're both advanced practice nurses. We have our degree, both of us from Loyola, nursing program, their master's program in cardiovascular health and disease management. And so...
Could we stop so that you interpret?
Oh,
听到哈，这个是护士心脏专科的设施。
These are advanced practice nurses.
是先进的 ，advanced 先进。
And they job share.
他们两个一块做，both of them, right?
Yes.
Right. 他们两个。
For acute MI.
QMI.
So that's going to be section 2.
QMI 我不知道是
That's
section
section
2
2
在第二right
of
here.
the binder.
Yeah.
One of the things we're going to be talking about are order sets, and also we'll be talking about core measures. So I'm not sure how much information you've received kind of on the process of how order sets and care plans and care maps came about. But basically, in the 1980s, the government developed under the Reagan administration a system of DRGs. Okay, so the DRGs set up for each diagnosis, you have this length of stay and this reimbursement for that diagnosis. Okay. So in 1983, the CMS, which is the Center for Medicare and Medicaid, they took over the reimbursement component of this.
Medicare and Medicaid.
The other thing you'll hear me talk about is what's called, in other people here in the presentation will talk about, is the University Health Consortium, which is an alliance of 102 hospitals, academic hospitals, along with 184 of their affiliates. And what it is they represent 90% of the hospitals within the nation. And what this does when you join this organization, it helps you collaborate with other hospitals. You share knowledge. And it helps us improve our outcomes. So what I'm going to start off talking about is the chest pain protocol. So this is the second page. So our emergency system, or emergency department, developed this system as a way of guiding them to determine, is this a person that needs admission or not admission for their chest pain. So if they present with any type of EKG changes, elevated troponins, they're automatically tracked into either an ST elevated MI or a non-ST elevated MI. So this is just kind of the criteria or information that they'll look at. From that, like I said, when you look at lengths of stay, you need to accomplish certain things in a certain amount of time so you can get the patient through and also create best care, best practice. So we have order sets, and the first one we have here is the chest pain order set. So this is just basically somebody coming in with chest pain. These are the order sets. They did not rule in for an acute MI, but they will trigger, like maybe they ruled in for heart failure or other conditions, and they get tracked that way. But this one's if they don't have an MI but just have chest pain. Troponins are negative, they have to look at other causes. Maybe it's a GI cause or something like that.
这个是不包括 AMI。
This low risk chest pain.
So this is somebody that we don't think is coming in with an acute MI. They have chest pain.
不重要的。
They haven't had EKG changes.
他的 EKG 没有改变。So this is the order set, right? You mean? Do they have the order set?
This is the order set. This is our low chest pain
Okay,
order
那个是
set.
order set.
And this is what the doctors follow.
都是 include the AMI 嘛 is on the set.
This not isn't an AMI order set. No.
可是order set right right， 它不对，可能是 order set 是给他确定是不是用 QMI。
It says chest pain non-acute.
Non-acute.
Non-acute MI.
Right. So now we have to figure out other causes. The next page is, or the next order set is the unstable angina or non-ST elevated
比较
MI.
轻微的那个，比较轻微的，那个比较轻微的话就用这个就看就上来。
And these patients, so their EKG does show changes, but they're not showing the ST elevation. So this is the criteria or the order sets we follow
那
for
个也是
that.
order set，
And the key thing about this one,
所以说
anything that's checked on these order sets automatically will be part of the order, unless the doctors
Yeah.
unmark that.
因为是
Okay.
我分开来，所以有勾了就是order 了，除非医生说拿走。
So when they come into our emergency room, within 5 minutes an EKG is done. So we know what type of rhythm is there, whether there's an MI going on. The other thing we get back usually within 6 hours is like their second set of troponin. So once we get that second set of troponin, we can see if there's an elevation, which also triggers us that this is an acute MI case. There are other conditions that can trigger troponin elevation, but for the most part, this is the way they can cue into specifically whether getting this patient into the cath lab to get further treatment.
他们就是用这个来勾来决定病人应该做什么。
5分钟之内到急诊室要做EKG。
So
24小时做troponin，对不对？24小时。
yeah. Now the key thing in, like I said, anything checked automatically is there unless the doctor unchecks it. But when it comes to medication therapies, it's not checked automatically. And there's two key things that have to
药方
happen.
面呢就不是自动的 check 了。Go ahead.
So for any patient with an acute MI, they need to have aspirin in 24 hours
马上要
and
给
a beta blocker in 24 hours.
是这样，对不对 ？aspirin 是一样的。
If they
马上要给的。
have a contraindication for receiving that, that needs to be documented.
要写下来，这边最重要的记录的，马上要给他 aspirin。
多久之内？
要记录。
多久之内
I'm sorry, I missed. How soon you have to give aspirin?
With both aspirin and a beta blocker need to be given within 24 hours from arrival into the emergency room or arrival into the hospital.
24小时之内马上要给的。And the blocker, I don't know.
Beta blocker.
Beta blocker.
Okay. The next set of orders we have, but we're in the process of reorganizing them, is the ST elevated MI. And the key feature or component on that is these patients, when they come in and their EKG shows ST elevation, they need to get in the cath lab and get an intervention, either a stent or a balloon opening up the vessel that's the culprit.
他就是要这个血管开，要不要张开？看那个 balloon 就是这个球血管张开那个手术。
And the guidelines from the American College of Cardiology and American Heart, who we follow, their guidelines, their recommendation, this has to happen within 90 minutes from arrival.
他就是两个组织要决定，然后他什么情形之下90分钟就要把那个气球啊放。
So If they find that this patient has the ST elevated MIs, the order set then that needs to be followed is this pre-catheterization one.
他们越是决定是 ST 那个就刚才那个几乎提高，就是看 EKG 变化，
不是提高啦，是提高，升高了。
So anytime they go into the cath lab for an intervention, that is the order set that is followed.
就是 cath lab 的 order set 啦，就是他们是对的，是 cath 是 order set， 心导管。
The next order set is post-cardiac cath. If they did not have an intervention,
这个 pre 的 post 在后面的，
such as like a stent or an angioplasty or a rotablade,
就是它里面没有一个管子，小小那个管子已经放过去了。angioplasty 就是血管定营手术，是不是？那是心导管。
then they'll get just the routine post-cardiac cath orders.
就是普通的了 ，routine 就是普通这个 order。
If they get an intervention, such as an angioplasty or a stent,
就是有的话，
they will get the post-intervention orders.
就是 post intervention order。
And one of the things,
有这个管子啊，有两个，有个 regular， 有个 standard， 有个不 standard 的，这个就是有管子啦，它就是给你不同的 form 去用而已，但是你不是这一科，你也不是。
any patient that has an intervention,
每个人都有
there is an order for us to see that patient for risk reduction education. So anybody that is seen, gets a angioplasty, a stent, automatically has an order for us to see that patient.
他们就是有所有刚才讲过的定营手术啊，都要 order 他们去见的。
And that's the advanced practice.
That's the advanced practitioners,
就是他
which would be Barbara.
就是他们的advanced 就是先进的，
And
就是让他们去看的。
Barb will go over.
他们去看。You go to see the patient.
We see the patient usually the next morning, the day after, and we teach them about the various risk factors and lifestyle modification, because cardiac health can be, or cardiac disease can be prevented if you do some lifestyle
他们
changes.
就去教那些病人，是他们去教那些病人，要怎么改变他的生活方式啊，吃什么。
So
I'm not sure they know what an advanced practice nurse does as opposed to another type of a nurse. They don't know what the Chinese system has.
他们的工作。
Well, as far as advanced practice nurses, in here, we're allowed to do more education. We do more of an assessment on the patient. And,
他们的主
it
要
varies
工作
whether you're a clinical nurse specialist versus a nurse practitioner. Clinical nurse specialists do more teaching and education. And nurse practitioners are more hands-on with the patient, evaluating the patient, placing in orders to improve their health outcomes during their hospital stay. We do more just risk reduction. Our role here is just to educate patients.
他主要是
The
教
goal
育
is,
病人的。
again, that if you educate people, hopefully they change lifestyle to the point
希
that
望
maybe
他们
they
的
will
生
not have
活有
another
改变啊，希望以
event.
后不要再有心脏病。他们主要。
那不好意思，我要确定一下，他说是management job is managing to educate, right? NP nurse practitioner. Sorry, so you are a nurse practitioner, right? So your main job is to I don't know.
Diagnose and treat.
So
More diagnosis, and they're doing more an
Right.
evaluation and more of the physiological component of the patient, based on what their lab values show, based on how they feel, based on what they hear in their assessment.
evaluation.
So they do more evaluation. They'll order chest x-rays on the patient if they don't sound right. They'll do more of that. We do not. We do more of watching to see if they are getting the care that they should get while they're here in the hospital and manage it that way.
So they're clinical nurse specialists, is that?
nurse
Yeah.
practitioner.
clinical specialist.
Yeah, master's prepared.
病理是怎么样
And
做多
they're
些
hired
什么测验
mainly for
他们呢
case
就是教
management
育
with
这
the
边
education.
And the nurse practitioner do more about the evaluation and the change the order.
That's right.
Yeah.
That's correct.
Yeah.
Yes.
NP
就是
专科护理师。
对，专科护理师，所以
So you also are nurse practitioner, but you are advanced practice nurse also.
他不是。
I'm an advanced practice nurse. Under advanced practice nurse in Illinois, where we live, you can be a clinical nurse specialist or a nurse practitioner. That's an advanced practice nurse.
就是
我跟你
他
讲，那个
们在上面
进阶护理师，包括专科护理师，还有个人管理师，还有
工作是
不一样，不一样，不一
对对，
样。
比方说各管的工作是教育嘛，对 education 嘛，为教。可是他说 NP 的工作也是为教啊。
NP 的工作比较多的是在改 order 方面的啦，就像我们台湾这样子，就是跟 doctor 一起，然后看他 evaluation 他需要什么样的改变，就是会去改变 order。他们比较 focus 在 education。Your job is focus on education, the disease change of the life, how to apply the life change. And the nurse practitioner almost evaluation the patient's physiology and order change.
Right,
Yeah.
they see the patient before surgery, post-surgery,
Yeah, yeah.
and take care of their physiological
Yes, physiological. Yeah.
more concerns.
advanced
We-
practice nurse, 他是advanced practice nurse.
We went to, we went to school for 4 years, got our bachelor's degree, then went to a master's program. You have two choices. You could be you got three. You can just get your master's degree, you can become a clinical nurse specialist, or you can become a nurse practitioner. So we took the clinical nurse specialist route.
他们是临床部，
反正进阶护理师分很多种嘛，其中有2种在我们现在目前的是 NP，就是那个专科护理师比较多的一些医疗处置，当然教育护理师，但是在 nurse practitioner 它比较多的是那个叫什么 clinical nurse 或是 case manager 比较多的是在教育这样子，不一样，他们不改 order。
Okay. So earlier I said Loyola is part of the University Health Consortium, which is an alliance of over 90% of the nation's hospitals are part of this organization. And what they do is for various diagnoses, are they understanding it?
他们就是跟一个组织有关系了，很多学校的医院都是跟那个组织有关系，都是在里面了。
For various diagnoses, in our case, the American Heart Association and the American American College of Cardiology, the ACC, said if you have an acute MI, certain things need to happen.
也是在讲了，我这边都有一些组织要控制他们做的怎么样的，就是他有应该怎么样步骤怎么做，那现在告诉你们有这个组织的控制他们心脏病要怎么做。
So for the acute MI patient, they need to receive an aspirin and a beta blocker within 24 hours.
刚才讲过了，一个心脏病的病人马上要 aspirin 跟 beta blocker。
24小时。
They need to, if they have an ST elevated MI, they need to have an angioplasty or some intervention within 90 minutes upon arrival into the hospital.
ST elevation。也是马上要做那个血营成年管啊，跟那个做。
多久之内？
I mean, not so acute. So, the other is that when they go home, they need to be on aspirin therapy and a beta blocker. And if their ejection fraction is less than 40%, they need to be on an ACE inhibitor or an angiotensin receptor blocker, an ARB.
I don't know all that. 明白吗？这回家就是要 aspirin, beta blocker, and then the rest of it.
If their ejection fraction
Ejection fraction 你知道吗？
is less than 40%, they need to be on an ARB.
ARB or an ACE, ACE or an ARB.
IV 就是给他 IV。
Not all the patient need that drug.
If, not everybody, if their ejection fraction is greater than 40%, guideline says they don't have to have an ACE or an ARB. Unless,
那个是那个 EF 啦，EF 就是他的心脏功能，他的左心室的功能。EF 功能如果大于40的话，他们就不用。If EF larger above 40%, they don't need the beta blocker.
no, they do need the beta blocker
Yeah.
because research shows that if you put somebody on a beta blocker after an acute MI, the risk of them having another MI is lessened considerably. So it's protocol that they should be on a beta blocker unless they have heart block or bradycardia, hypotension. They just can't tolerate it. But if they have no contraindication, everybody who has a heart attack should be on a beta blocker.
前面是觉得一定要，你们不是吗？
就是40%以下的话，好像不用那些药了。
And that's based on research.
Yes.
他研究结果
Again,
是这样
American Heart, American College of Cardiology.
有两个组织啊，不用继续服药吗？就不用
他是说他 EF 大于40%以上的话，就不用服那些药。
这不用回去之后跟 ARB。
ACE 跟 ARE 啊，那 ARB
，right
那 ARB 那个些还是要。对。
大于40
大于40
功能
不用。
越好都不是越好吗？越大越高。
就是因为好，所以不用那个药。
不用补那个哪两个药？
这两个药 ACE 跟那个 ARB 啊。ARB 是。
And that's all in the papers, right?
Yeah.
在里面的，
Yeah,
在里
it's in
面
the
的还有
paper.
paper，你的
It's in a, this is, it's not like, it's always there as an order, but it's, what will be in the paper, when we get to the next section, and I talk about the assessment tool from UHC, this is going to be more, when we get to this,
Okay.
that's where it's going to be. It's already in the orders.
已经写在里面的了。
This is UHC.
Here.
Oh, you're not, are you not at that?
So if you guys, we go to this assessment tool, the
就是这边的不要
UHC.
看，就是前面。
So you're at the beginning.
Okay.
So we're just going to start.
So
他们现在讲这个。
the University Health Consortium has these tools
一个叫用具，用具。
to help us evaluate each chart that is an acute MI patient. This
都
is
是
what
来
we
决
use.
定，都是来决定是不是
AMI 啊。
So we get a report of who came into the hospital with an acute MI. We then go through a system of evaluating to see if all the criteria is met.
他们要看那个人是不是都是这样子才算是
And that's your role as a case manager.
This
right?
is our case manager role.
他就
Yes.
是他要
As
做
a
的
case
事情就是
manager,
决定那个病人
we
是不是
evaluate
哦，就是这个是他评量。
are
对
the
对，就用
are
这个来
we
评
and that it,
评
you
量
know, this here tells us the best practices to take care of an acute MI. We know from research
他们一定要
that in
这样
order
做
for you, if you have an acute MI, these type of practices will hopefully inhibit you from having another event or weakening your heart muscle further.
不是啊，他们说这个是帮助他以后不再发生那个 QMI。
So the first page is just kind of telling us where the patient came from when they came into the hospital, what time did they come into the
就
hospital.
是他什么时候进来是资料而已。第一篇是好，可能后面是 patient
The second page
第二章就是
looks at discharge. Where did the patient go when they left the hospital?
他回家去哪里呢？
And then there's questions whether they got transferred from another facility.
就问他是不是别的地方过来的呢？
They want to know the birth date of the patient.
年纪多大？
On the next page, the very top one, some patients come in and they're very sick and realize right away that there's not anything we can intervene and do for them. So a lot of families have made the decision to make them what they call comfort measures, where they just make the patient comfortable. We do not do any.
他们越是不可以救他的话，就让他舒舒服服的。
We don't do any interventions. We don't give them any medications. We just put them in like a hospice situation.
差不多 hospice 的情形了。
The next question asks about whether we are doing. Sometimes there's new research on a certain type of stent or something like that. If there is any kind of research going on with one of our patients, we have to indicate that.
他们有很多做很多研究的，就就是那个病人是参加的，他也要写在那边。
The next one talks about like when did the patient come into the hospital. So again, the date of that.
就是下一张是他什么时候进来的。
Then this is where we get into the medications. Did they get their aspirin on arrival? Did they get their beta blocker on
他进
arrival?
来也没有马上用那个药呢，因为他一定要 receive aspirin。
And they'll tell you some idea, like for aspirin, if they're on Coumadin, technically that's a contraindication. However, most of our patients will still get their aspirin. The other thing about, like again, if a person has an active GI bleed, that may be a reason why they don't want to get their aspirin in there. So as long as the physician has to document somewhere in the progress note why they did not get either the aspirin or the
因为
beta
这个是
blocker.
一定要做的嘛，就是他没有收到的话，好像 aspirin， 就医生就要写，为什么不给他呢？就是他胃流血，当然不给了，就是写原因。
And the other component for like the beta blocker, again, if they have some kind of heart block going on, second degree heart block or complete heart block, again, they're not going to get their beta blocker. If their heart rate's under 60, that's contraindication from getting beta blocker. So it depends upon what's going on with the
举例
patient.
为什么一定要给他们的药不给，就是要讲清楚为什么不给了，他们是那个血管塞啦就不给了，是不是？
And
有多。
the University Health Consortium provides a whole list of documents on, what is acceptable as a contraindication, what is, what identifies comfort measures. They provide you a list of how it should be documented in certain things, like for comfort measures, if it says do not resuscitate, that doesn't qualify it as a comfort measure. So there's certain things that they help us as case managers and when we're reviewing the chart, looking for the proper documentation to qualify that.
他学校有很多档案、很多资料，也会给他们用，来也是辅做这边要做的，他们可以有其他的档案，就教他们其他的怎么做，也可以的。
And for the bottom question, it says, is it an ST or a non-ST elevated MI? Now, if you look at on the side here, it tells you if it is an ST elevated MI, do this. If it's not, you do not have to answer the following questions. So they kind of guide you on what information they're actually looking for.
他们 ST 就是不是这样子的话，就他会一条条答的。
Where's the beta blocker? Right here. So if it's not an ST elevated MI, from 13 to 21, we don't need any of that information.
他就是给他知道，要是不是的话，就做什么。
Now Loyola usually gets people
因为
directly.
要是你答 no 的话呢，就那些问题不用答啦，那只是教他怎么做而已。
Loyola usually gets people directly from the hospital, and as a result, we don't use TPA or any kind of fibrinolytic therapy. So most often we're not addressing that issue because we don't give it. And most patients coming from another hospital, usually you cannot have an intervention once they've gotten it. So,
from other hospital.
if they come over here that had the TPA, they can't get an intervention right away because they had the TPA.
As a academic medical center, we get transfers from many community hospitals to this hospital.
很多其他医院的病人会送过来，因为他们是学校医院。
他们好像说 ，if you give from another hospital, they give TPA, they don't use this kind of drug.
We don't use it at all here, but if the patient got it from somewhere else, they can't get an intervention because they'll bleed too badly.
Yeah.
So they usually, we never see these patients is the bottom line. We usually never get these patients.
Because we take them right into the cath lab. We go right from the ER to the cath lab.
If they
it's
get
indicated.
TPA because easy bleeding, so doesn't insert catheterization.
Right.
Yeah.
Yeah.
因为 TPA 很容易出血，所以如果从其他医院来的话，给了他那个药，他们就不敢给他做心导管。
So the key thing on this page is we were looking to see if they did get an angioplasty or a stent or
就是他有
rotablade.
时候涂完的话，就不是检查。
When did the intervention, what time did the intervention
什么时
occur?
候做
And
的
this is,
也很重要，什么时候做的？
we only evaluate the time of the intervention on the ST elevated MIs. We're not worried about the non-ST elevated MIs time that they get from, we're not concerned about the door to balloon time, as we call it. So the minute they arrive to the time they get that artery open, the only cases that we look at are the ST elevated MI, because those are the ones that are going to have the injury issue.
是 ST 升高要做you care ST related patient to insert in how many hours?
Within 90 minutes,
90 minutes.
their blockage needs to be opened up.
Yeah.
Yeah.
90分钟内，如果 ST elevation 的病人进来的话，就要给他做那个 balloon，因为要把那个 block 给冲掉，就是血栓了。
And that's to prevent the heart muscle, to preserve the heart muscle. Otherwise, their risk of heart failure, beyond that point gets more extended and things like that for the future. Then the last page is on discharge. Did they get the aspirin on discharge? Did they get the beta blocker on discharge?
也是一样的，他们进来之后有没有用阿司匹林啊、beta blocker？
And then they ask you, again, that question, is their left ventricular systolic function less than 40%, the ejection fraction less than 40%? If so, then they need that ACE or ARB at discharge.
他有说什么40%那些什么，你知道他讲什么吗？
对，然后
OK，
And again,
知道就好了。
they give us reasons why, what constitutes contraindication. So if there's a contraindication, it again needs to be documented, and there's certain criteria of what the UHC, or the University Health Consortium, will accept as a contraindication.
他也要写好了，总之要写清楚了。
就是说 EF 小于40的话，要给他 SEI， 刚才有讲到 ARB 啊。如果你不能够给他，是为什么？有什么样的不适应症要写清楚。同样的出去的话，还是要给他那个 beta blocker 药跟那个 aspirin 这样子。那为什么不行？给他还是要写清楚。
The last page is about lipid cholesterol, and at this point in time, that is, you can volunteer to put that information into the system. This is not required by the University Health
他
Consortium.
们的管剂不是一定要放进去了，那个就是胆固醇啊、脂肪方面的。最后一页我们不是一定要放进去。
放进去什么？
And at this
报
point,
告。
we do not collect this information here at Loyola.
现在学校医院不需要收回来的。
这张不用放病历就是了。
不是一定要。
I would say
可以放进
probably
去
95% of our patients go home on lipid therapy. We start lipid therapy right away on them. A statin usually, we'll start like Lipitor on them when they're here in the hospital, because most often, especially in the non-ST elevated MIs, there's such an inflammatory process going on that if you give the statin, you help control some of that inflammation component.
他说，虽然不是一定要，但是95% 都有那个 lipid therapy 带回去，因为可以控制了发炎，因为放了东西进去之后，有机会发炎。
Okay.
知道那个是什么？
Our next section,
这样吗？
你知道吗？
不知道在讲什么。
lipid
You just say control the LDL level at home.
control the liver,
Low density.
cholesterol, LDL.
Low density.
lower
Density
the,
cholesterol.
say that again.
Is say LDL cholesterol. You control it.
Controlling the LDL
Yes,
cholesterol?
in the community.
Right, right.
I like diet education. Yeah.
What
With-
we educate, she's going to talk about what we teach. But we, on any patient that we see, we get their current lipid profile.
每个病人他看的都知道他血管有多少肥皂。
And we look to see what's abnormal.
什么是
And
不
then
正常的？
key in on that. So LDL, we talk a lot about saturated and trans fats.
他很多看
They
就是
talk about diet
LDL
modification. That's
胰高
the
嘛
key one
就
for
是
that
血
one.
血的肥。
HDL, we talk more about exercise, weight loss.
就是另外一种
Try to get triglycerides
就叫他们
information, get them
运动
better
啊
on that.，
运动方面就会帮助他们。
So it's not, like I said, we don't collect data on the lipid information or the cholesterol information, but we do educate everybody on their lipid
他
profile.
那个报告不要送进去，但是他都会看这个报告去教育病人。
The next section is, you'll open to this. And again, like I said, we give this information, we put in this information on what we collected from here. What we collect from here, we put into a database in the UHC system.
他们所有的资料放到 USC 那个 system 里面的。
So the University Health Consortium has a way or a database that we need to enter on every patient that has an acute MI. We enter this information into it.
他们所有的 QMI 的病人的资料都有放进去的。
From that data that we enter, we get this. This is our report on how we measure up to all these other hospitals within the university health system.
所以资料放进去之后，就可以比较他们所做的跟其他的医院是比较的。
It's a national benchmark for us. So this is a way for us to compare ourselves to other similar type hospitals.
它就是整个美国来比较的。
So if you look at our composite score, your goal is you want to be at 100% with all your measures.
这100% 是最好的啦，当然。
And when you look at our composite score, we're averaging 90%.
他们的分数是大概90啦。
And when you see how we compare to the other hospital organizations, this is the best performers at that top line,
上面一个
and we're kind of the
其他医院
zigzag pattern
比较了，
on
他们是蓝色的，
the next line.
他们好像高有低。
Our biggest issue to our core measures has been at Loyola. Our biggest problem with our core measures has been water balloon time.
就是把那个包包都
进去的时间
时间进去的时
也知
间。
道这个就是
So
因为他30几这个就是
if you go to the next page where it's percutaneous intervention within 90 minutes.
90分钟啊，他应该放进去90分钟的。
Right now, we're only at 40%, 41% of meeting this requirement.
他们达到那个目的只有40%达到这个目的。
As of
90分钟放进去那个一些血管有什么问题，他们
June 2006,
他会做得到。
the measure went from 120 minutes to 90 minutes, and that's again based on research from American Heart and American Cardiology Conference or American College of Cardiology. You know, they're saying that to preserve the person's heart muscle, that ideally you should be doing these procedures within 90 minutes
他
of
这两个
arrival
数
into the
据就是
hospital.
讲了，越是令到心脏的肌肉不死的话，一定要90分钟马上做那两个手术。
Now, we've looked at this considerably. We spent a lot of time on this, and one of the big concerns or our issues here is our community EMS system, our emergency medical systems locally do not have the funding at this point to provide an EKGs at the site of the when they get to the patient's home or
他们的社区就是没有够钱，说紧急的时候马上给病人这个 EKG 啊那些不够钱。
The idea being is if you get an EKG in on site or when at the point of intervention when they first arrive, the first arrival scene, and you get an EKG and it shows ST elevation MI, you can call in that to and they can get that cath lab work in, they can get the doctors all notified that this is coming to the hospital, so it saves time.
就是他们就是说不够钱做 EKG， 在当时马上有病人的时候，马上在那边做的话，他知道他不对的，有 elevated AFC， 就可以马上那个 lab 准备帮他做，但是因为现在不够钱嘛，没有做到马上做 EKG， 所以他们的分数都不高了。
In terms of the other interventions or the other things we evaluate, as aspirin on arrival, we've been at 100% since 2006. January.
到现在他们做得很好，病人进来24小时马上给 aspirin， 100%。
Aspirin at discharge, we've been at 100%.
他病人回家给他 aspirin 也是100%，做得满分。
And when you compare us to the other university hospital systems, we've been doing better than them on those two measures. So aspirin on arrival and aspirin at discharge, we've been at 100%. The others have been more at
跟其
pretty
他
close
医
to
院比较的话，
98%.
他这两方面做得非常之好，比其他医院的好。
The next one is the beta blocker on arrival. We had been at 100% since January of 2007 up until April of this year. And it was a matter of a patient coming in and the medication not being available right away from pharmacy, so the patient didn't receive it.
他就从去年1月07年到今年4月8号 beta blocker 都做得非常好，但是之后呢就药不够，进来没有药，没有给 beta blocker， 他在讲。
What Barb and I do as case managers, go into the computer system every day and evaluate to see if the patient's on the aspirin, on the beta blocker, and if their ejection fraction is less than 40%, are they on an ACE or an ARB? If they're not on any of these, we look for documentation to indicate why they're not. If there is no indication of why they're not, then we call the physicians to ask them, why they're not, and get that clarified.
Broughton 他就是嘛，时常都看着电脑，看看他有没有给了，为什么不给呢？EMD 他刚才讲的我不知道了，有一些时候他 为什么不给的情形是他不对呢？他就会打电话给医生，为什么不给？
Cindy, when you call the doctor, do you document in the medical record the results of that conversation?
No, I do not.
他问他跟医生的交谈有没有写下来了？他说没有。
What I usually do is create like an email or it's kind of like sometimes how we do it, you know. And it's either emails or I just create a Word document and have that attached to the
But it's
patient's
not
chart.
in the medical record?
No, it's not.
Okay.
No.
他也会
Because there may be a reason that they haven't gotten to it yet or documented and just kind of it's sometimes physicians when they make their rounds and stuff like that, you get so many things going on, little things can get missed, and so it's just kind of a way for us to keep up on it and a way for them to
他说有些医生做很忙，
make
可
sure that it
能
does
是
get
是忘了还是怎么样，因为太忙的缘故，但是他没有写在病人的报告上面，你们有没有问他？
So in terms of beta blocker and discharge, we've been at 100% again since I think it was 2007. What happened in December 2006, why you'll see this dip, is when we transitioned over to the electronic document Epic. So once we did that, we were able to read their notes on a daily basis. We can see their documentation much easier, and it's helped considerably.
因为他们在装一个电脑 Epic， 所以有个 point 就是低下去。
Our ACE and our that was one before the electronic record. We really had a hard time because it was a discharge medication. So now we try to get that discharge summary within 24 hours, hopefully, from the doctors, and we can follow up if an ACE or ARB should have been given and it wasn't given and there's no documentation. We can get them to do an addendum to the medical record.
ACR 就是现在有电脑了，应该可以24小时是要给他了。你知道这 ACR 是什么吗？
And then last is our smoking. Anybody that's been a smoker within the last 12 months needs to be counseled against smoking. And that is one of Barb and I's other components to our job, is we see all the patients for smoking cessation in the hospital. And Barb will talk more about the program that we developed for that.
抽烟的人，他们都会有见那些病人的啦，还会都给他教育，抽烟对身体的不好。
Any questions?
有问题问他吗？
这个100块钱就是抽烟的这个吗？
以后对抽 smoking resisting
就是给他喂教呀，
就只是告诉他 smoke 不好。The page
给
here
病人喂教，就是把他白讲，因为每个病人都有给他喂教。
Does that mean you just talk to all smoker?
We talk to see, the thing is, we always know who our acute MI
他跟他
patients
谈就好了。
are. And then Barb will show you too, in our discharge instructions, there's a way we can capture smokers who maybe didn't get counseled. So,
那如果像那个没有达到100%的，为什么原因没有给他喂教？有没有去？比如说为什么给他喂教？有原因有吗？
卫教什么卫教？
比如说这像有些证没有达到100%嘛，表示他是没有给病人，为什么？
这是other hospital。
不是他们。
不是他们，是他的，比较，对比较。The next page is comparison between other and the national.
okay. Thank you.
Okay, I'm Barb. I'm going to take over, and the best way I'll try to explain the rest of our outline for today. Just to regroup you, at the beginning of Module 2, there should be outline, so I'll show you where we at.
他刚是
Okay, Cindy explained down to this, and I'll explain from patient education. I'll try not to move so that way you don't have to change it. From patient education down. So I'll talk about patient education and evaluation, discharge planning, and other programs that we have, the smoking cessation program, which involves training staff, nurses, and physicians.
Patient education down. OK. 他就是这边，他只是告诉你他刚才讲什么，现在 two。他刚才讲，现在讲 smoking。
So I'll try to do it in simple easy way to understand so that way we can keep up?
他用最
So
简单的
go
话
back,
跟我们讲。
go back to
我
where
们
you
回
left
去
off.
回去看这个表。
Why don't you go to this page? Cardiovascular.
哦
This
how far
one.
back?
Okay, great. You both are already on that? Yeah, this page. Okay.
Is after the graph or before the graph?
After, right after the
Okay.
graph.
2.
So that way everybody will be on the same page.
Yep.
哦 OK， 它是最后的。The second page， 还到了没？
You went too far, I think.
Too far?
Yeah. 2 pages down. One more.
One more.
Right there. Okay, so when the patient comes in and the first 24 hours from the admission is diagnosed with heart attack or with coronary artery disease, then we get a referral from physicians to go and see the patient for education.
当你病人进来的，因为他有心脏病啦，医生叫他们去看那些病人。
Okay. When we see patients, this is the template that we use. That's the one that you're looking at.
看
And
这
what,
病人，他就用这个表。
the top portion of the template, what that involves is just includes it's just basic past medical history of the patient, medical record name, date of birth,
就
and
是
then
资料的他有什么病都在这边写。
then we go to the second part of the template, which is really individualized evaluation of the patient. That involves risk factors, cardiovascular risk factors that you can change. There are 2 types. The ones that you can modify and the ones that you don't have impact. Like family history or your age or your gender. You can't change that. And when it comes to
它有一些事情是不可以改的，有些是可以改的，就是看下面什么情形是它可以改，有些不可以改了。好像年龄啊就不可以改了。
Okay. When it comes to those risk factors that we can change and we can have huge impact on our lifestyle, we list them. So that starts from number 2.
它通常是第二个他们可以做的，就是他有什么可以改变，就帮助他。
As Cindy mentioned earlier, that every patient has lipid profile, which is the cholesterol, which includes the total cholesterol, triglycerides, the healthy cholesterol, the HDL, and the lousy or the bad cholesterol, LDL.
他说每个人呢，其实都有这2种胆固醇的啦，好的是 HDL， 不好的是 C。
So we get a copy from the system, from the EPIC, electronic medical records, and we go over that with the patient and the family is present at the same time. And we inform the patient what's expected, what's the goal for the patient, and what needs to be done to improve the numbers and his either diet or the patient maybe needs to lose weight, exercise. So whatever recommendation needs to be made appropriate for the patient, we do it when we see the patient.
他看的这个 EPIC 的 computer 就是有他的资料了，他们就会跟他的家人那个病人一起谈论，看他目标是怎么样，看看他是怎么样去可能运动啊，可能做其他的就帮助他。
Okay. Then we go to the next risk factor. So diabetes, if the patient has diabetes, yes, no, what type, if the patient needs medical therapy, overall, if the patient is diabetic already, how well is the diabetes control?
但是第3行呢，就是那个糖尿病了，他那个控制的糖尿病好不好啊？他就用什么药啊？他就看那边。
Okay, so I don't want to go one by one to waste the time. Just so you know, then the next risk factor would be hypertension, smoking, stress, alcohol use, patients overweight or inactive. For each risk factor, we make recommendations.
他就是一项一项去看呐，而且第4就是高血压，抽烟、烟抽，看一项一项的去看呐。
Questions?
呀，有什么问题？
Okay.
高血压 therapeutic intervention
In a
就是康复那个 康复的治疗。
Okay. In addition to our recommendations, verbal recommendations with the patient, we give them written material, additional written info that they can review at home, and this is all about their heart disease.
他们又可以用口讲去教他们，但是他们也有一些资料，他会带回家的看。
Yeah, they get a folder, and that folder includes everything about from the basic to kind of more advanced. Basic would be about heart, how in general the heart works. About then it goes to coronary artery disease. Then general info about each risk factor.
这个他会以本子带回家，病人带回家。有这个很简单的，就是心脏是怎么样运动啊，人的心脏是怎么样啊？还是更加强势的话，就是他的病是怎么样啊
The information that we give to patients in order to provide continuity of care and consistency of care, this is the copies, the printouts are from what we call patient education or micromedics. We use care notes that any healthcare providers can pull, not just us. So that way, if the patient comes back for follow-up, leaves the hospital, goes home, comes back for follow-up to see the physician, there's a consistency. So the physician will know, okay, this was already done, this is what we need to reinforce. So that way there's not so much repetition, redundant work, unnecessary work.
他的给他资料带回去了，然之后他的档案都会留下来的了。然之后他在发生的时候，也看看他的资料，然之后那些医生不会再做同一样的东西，您知道他以前做过什么。
Care notes is part of the EPIC documentation system.
Care note 教顾写下来的东西都是 EPIC， 就是那个 computer system， 就是一个电脑写的，就是他们的 EPIC。
只有在记录上在电脑上，就是查询就可以看到。
对，all the record recorded on the EPIC, so you can look up the past history, right?
Also, patients who had interventions done or had a heart attack qualify for, or they're diagnosed with coronary artery disease, they qualify for specific exercise program for cardiac patients, which lasts 3 months, and they go 3 times a week for an hour, and they will be monitored. It's not just exercising, but they're monitored by professionals, either physiologists or nurses, cardiac nurses, and they're hooked up to the EKG monitor throughout the exercise, so we know exactly what their heart is doing, what their blood pressure, what our vitals are, and the physician gets the report from each session.
他心脏病的病人有一个 program， 他们可以用的，就是他的所有部分，他们都会看到他的情形。Would you repeat what do they do in the program?
They exercise for 1 hour, 3 times a week. Each patient has their target heart rate, how fast or how powerful the exercise should be for each patient is determined by their cardiologist.
他这个 program 就是1个礼拜3次去运动，但是不只是运动啦，他其他的测验他们都会在那个 program 里面。
Also, when they're
Barbara also mentioned micromedics for patient education. That's a software. That's a separate software that we purchased.
这个元件 micromedics 这个元件，他们要买来电脑用的元件。
软体。
It's a patient education software program that we purchased.
这是一个仪器，
教育软体啦。
教育的软体在电脑上面。So it's like a printout.
Yes, we can go into the computer and print it out, and it's an annual contract. We have a contract with Micromedics company.
It's like a movie. It's a 动画的。
it's actually you get a printout of description. If you have a heart disease, you can print it. It's not a movie, it's a written information that any of our healthcare providers have access because it's electronic from anywhere, any satellites, any clinics.
And it's got medications on there as well.
Yes.
所以你们也是那个东西
卫教单张，
一直单张。
对 patient education sheet，
Patient education.
你要什么样的东西？It's just for cardiology.
It's not specific to cardiology.
okay.
It's for all over. We use it
Okay,
throughout
okay.
the hospital.
它是一个卫教的资料库吧，你可以所有的卫教单张从那边印出来的，给病人。
It's really nice, it's really convenient because that way, as we healthcare providers, we're consistent with the information that we give to our patients. So if we see patients when they're in the hospital, and if they go to see the doctor once they get home, then if they need additional information, then it's any of us can use it. It's not like we don't know what we gave the patient, you know. So it really, for the consistency and continuous care, it's a great way to follow up on the patient.
他说这个原体是很好的工具去 follow up the patient。
那个是每个人都可以进去
That continuum of care for case management is very important in patient
It's just
outpatient.
for it's just a print for nurse, not for patient.
No, it's printed for the patient.
Nurse give the patient, not patient's print. Or patient can
No,
see at home.
patients. There is one outpatient center that we have that's in an experiment right now on My Loyola. They can print their own, but at this point we generate it for them.
他们医院印给病人，病人不会上网去印，他们只能付钱。
Cindy spent so much time talking about standing orders. They're important because when the time comes for the patient to go home, we want to make sure that nothing gets lost. And as part of the standing orders, what the physicians or nurse practitioners have to complete at discharge is some of the information that we need to have in order to provide the best care for our patients, and also what's expected per guidelines, so nothing is lost. And what we have is what's done on our patients. That's part of the standing orders. It should be
他这个 standing
next
order，
page.
他是为了最好病人不会搞乱。
As you know, she talks so much about aspirin, beta blockers, ACE or ARBs on arrival. This also has to be completed by, like I mentioned, physician or nurse practitioner if they are receiving medication on discharge. If they're not, the reason contraindication has to be documented by either one, physician or the nurse practitioner.
这个就是
Okay? So that's part of the standing orders that eventually will have to be completed.
他在 standing order 就是他们带回家了，他们你问什么 ？Sorry 啊，你问什么？
是讲这刚才讲的。
他是想就是带回家的，对不对？他有医院也带回家的。
The graphs that you
带
saw,
回家才是可以他带回家要搞清楚他是怎么样才带回家。
this is important.
嗯哼。
This is important to be completed in order to have these graphs. Okay?
他所有的资料勾好了，也是有放到电脑里面，因为那边的资料才印刚才那本东西，他才看到了医院做的怎么样啊，做得好100% 啊90% 这个意思。哎呀，都是看他是做得多好。
Okay. Also, when on discharge, it means when patient is being
回家
discharged home or going home, they get nursing instructions, discharge nursing instructions. Okay? Which includes
护士
that's
他
next
回
page.
家的时候，护士会教他，
We're getting close.
对他要吃什么药啊？
Mary wants to
Yeah.
see it
So I
too.
want to print it.
他回家就带这个回去了。
Yeah, basically, this is important because it includes the schedule, a medication schedule, their
Yeah,
follow-ups
yeah.
with physicians, if they need additional tests to be scheduled.
什么时候用？
他这个可能是写时间点8点。
嗯哼。
And
这
also
个早上
smoking,
这个下午。
if they're smokers.
smoking 还有
So,
还有
at
抽
the
烟
bottom you have,
发抖。
for your health.
这个是给病人的嘛？哈。
对，病人带回家。
所以每个人是不太一样的嘛。
对，就有多少才想要
但是新装的药都是检测是不是？我是说
这些
可能什么时候吃不太一样。
比如说这个空白就是没有啊，有的话才写这样子。
Yeah, the nurses just put the time when they should take the medication.
Not for the oath if the patient is medicine just right here.
Right, the nurse will mark, okay, this is the time they need to take it. This is,
Okay.
yeah, so that's the schedule. This is, you have an example also in your binder of discharge summary, which we need for our patients that have been diagnosed with heart attack.
And the physicians write that.
医生写了这个。
Yeah, the physicians write the discharge summary.
这个是医生写的，他只是一个 sample 给你而已。医生写病人进来怎么样啊，怎么样啊，是医生写的。Is it patient take home with this too?
No, this is for medical records. That's for
放进你的档案 ，put in your data.
It communicates to all the physicians, anybody in the healthcare system with Epic access.
他是医生看的，医生看的。
So basically what that involves is when the patient was admitted, when the patient went home, what was done in the hospital, the whole health history, and what's the plan of care for the next, or maybe the during hospitalization everything was resolved, but that has to be documented and summary as well.
这个是全部就是病人的进来之后，医生做了什么，吃什么药，带什么药回去，全部就是放在他的电脑上面。
Okay, last part we have Cindy and I were in charge of the smoking cessation program here at Loyola. So if you go to next page.
他教导是看哪里？
We do training for nurses twice a year and training for physicians, especially new physicians coming to the hospital, the residents. We try to do it twice a year.
医生教护士的，1年2次，他们去教医生护士。
Okay. Also, so you have an example of our program is called Quit for Good, and you have a copy of this brochure. So it kind of describes what we provide for our patients, and each unit or clinic or satellite, they have the smoking cessation manual. Okay.
给医生护士给一个板子。
Every year this is revised.
每年
Okay.
都会改的。
And we just had a new law, state of Illinois. We just passed a new law, well not just, but in January, that we are smoke free. That means that we can't smoke in
Any public place.
public. Yes.
在美国，在 Illinois 起码 Illinois 什么譬如餐馆都不可以抽烟，都是室内
Restaurants, stores,
室内
hospitals.
室内不可以抽烟。
Okay. Questions?
Thank you.
Okay.
Thank you, Barbara. Cindy, you did a wonderful job.
Thank you.
It's challenging to go through an interpreter. We're not used to that.
We'll try to do it as best as we could
You did a
in
wonderful
the best way,
job.
but it's a lot of information, so.
Yes, it is. And that's why they came.
Enjoy Chicago.
This is, please, since we are women, we're really strong on taking care of yourself. This is about women and heart disease.
This is the American Heart Association program. We recognize women for heart disease.
这是
Okay?
Thank you very much. 女人要照顾女人。为什么？只是一个只是一个装饰品而已，只是表示我们女人要照顾身体。
I don't know.
礼物 presenting gifts. Where's the camera? I'm a photographer for the last 2 days.
相机照一下。We have a moon festival in Taiwan. This is for mooncake. Mooncake.
Very good. Thank you very much.
Okay, thank you.
One more. Okay, one more. 1, 2.
Very good.
Thank you.
Thank you so much.
Thank you, did a
Have
wonderful
fun.
job.
Enjoy it.
I'm one of the nurse practitioners. I work up here on 5 Tower with the CV surgery patients. And I was going to talk to you about the case management of CV surgery patients, as well as how the nurse practitioner role fits into that.
他就是 nurse practitioner， 他的工作是怎么样跟 case manager 一块儿。
他是 nurse practitioner。
Basically, the moment we decide to do surgery on one of our patients, the CV surgery, that's when the case management begins.
当病人需要 CV surgery 的时候 ，case manager 就开始了。
We have a close communication between the CV surgery team and the patient's cardiologist. A lot of times the cardiologist is who is sending the patient to us to be evaluated for surgery.
他就是开刀跟心脏医生一块开始的时候，通常是心脏医生告诉他病人。
Prior to surgery, a lot of times there is a need for additional testing, like cardiac catheterization or echo, and a lot of times we'll ask the cardiologist to have the testing done with them.
很多时候开手术之前有很多测验啊，那个心脏医生先做一些测验。
We do get patients that come from all over Chicagoland and Illinois and other states, so
病人是从各方各面来的。
It's important to have that communication between the cardiologists as well.
所以很重要，他们有跟他们谈。
We do, as a nurse practitioner, I do meet the patients a lot of times prior to surgery to do a history and physical.
他是 nurse practitioner， 他需要见病人，知道他们的履历，他身体的状况。
And I always try to get an idea of what their functional status is prior to surgery.
他要看看他们可以做什么。
So I can keep in mind what their needs might be after surgery.
所以他才知道开完手术之后他们需要什么。
Whether it be if they live alone and might need some help after surgery, or have other medical problems that make things more complicated as far as their activity and everything after surgery.
他要知道他们是自己一个人住啊，有什么其他病啊，所以才可以知道之后开手术之后要什么。
Once they have surgery, we also have a nurse practitioner that works in the intensive care unit only.
他开手术之后，在intensive care 紧急病房也有那个 nurse practitioner 在那边的。
So a lot of her role is seeing what the patient is like, what she thinks that they'll need afterwards.
他的就是看病人开刀之后需要什么。
She will then speak to our social worker.
他也会跟一个社工谈。
And that's the person that will then facilitate setting up, whether it be home care or the patient going to another facility for additional rehabilitation.
社工就是看看那个病人需要在家里面照顾啊，还是去什么其他地方的社工的工作。
Once the patient is able to be transferred out of the intensive care unit, they'll come to this unit here.
当病人可以出去那个 ICU 了，就来这边。
The nurse practitioner role on this unit is to evaluate the patients daily during the week.
这边的 nurse practitioner 就是每天看他一个礼拜看他情况。
So we do physical assessment. We write orders.
他们写报告，看他的身体的状况。
We discuss the patients daily with an attending physician.
他们跟医生商量，医生商量他每天的进展。
And we further work towards the goal of the patient being discharged from the hospital. Once again, making sure there's arrangements for either home care or if they need to get stronger, more rehabilitation.
他们的目的就是什么时候送病人出院，然之后有他以后的身体的状况。
At Loyola, our CV surgery postoperatively is different than other institutions because it is all nurse practitioner run once they get to this unit. There are no residents involved.
这边有些不同的， 在手术之后 ，CV surgery 之后呢，手术之后呢，是 nurse practitioner 去照顾，没有见习医生在这边的。
And I think that's part of the reason why we see the patients do so well, because we're very intimately involved with each person.
所以这边的病人是康复得比较好，因为他们跟病人很多交往。
Another piece of what we do here, that's our responsibility, is data collection.
另外一个他们责任呢，就是收集资料。
We use a database from the Society of Thoracic Surgeons.
他用的资料是 Society
of Thoracic Surgeons.
That's chest, the chest.
Thoracic.
Chest surgery.
Thoracic.
OK， 这就是那方面的资料了，对不对？就是身体。
I'll pass this around so you can look at it. But basically, we fill all of this out. Each person that has heart surgery, there will be a copy of this in their chart. The surgeon will usually begin to fill it out, but it has everything to do with their demographic background.
Janine, can I copy this for them? Is that allowed?
Oh yeah, you can copy
Okay,
it.
then I'll do that.
Karen just told me it was not in there.
Okay,
Yes.
so I'll make copies of this for you, okay?
We get an idea of their risk factors,
它的危险是什么？
which include cerebrovascular disease, if they've have had any previous cardiovascular interventions, such as angioplasty, stent,
有没有做过什么其他的手术？心脏的手术
or other surgeries. What their cardiac status is prior to surgery, so if they have heart failure, if they're having active chest pain, if they have any arrhythmias. Preoperative medications. We also have a place for their angiogram results, what type of coronary disease they have, what type of valve problems they have.
他们就是评估全部都有写上去。
And then the part here that the surgeon does will be about the surgery. If it's an elective surgery or if it's urgent or emergent.
他们得他们的自愿去做那个手术啊，还是没有自愿一定马上要做？
And then we also track the times of the surgery, when the patient went into surgery and came out of surgery, as well as the time when they were intubated and extubated. Because we do track, we want to know about any complications after surgery. So whether that be if they were intubated for a prolonged period, which by definition here means longer than 24 hours, if they have any arrhythmias, we have a place that once they're discharged from the hospital, we can record that. So basically this piece of information lets us know how we're doing. And then once again, how we compare to other hospitals that are doing heart surgery.
这个报告就是也是资料放进那个电脑里面，就是比较他们可以做得到哪一点，跟其他医院比较而已。
We also will go back and do a 30-day follow-up. So once the patient is 30 days out of surgery, whether they're still here or if they're out of the hospital, we'll see if there have been any readmissions for any problems.
他们有30天的看看他们情况之后怎么样。
Or any additional need for surgery.
30天之后变成清醒，
去追踪吗？
追踪。
Sure.
这个是 selected。选择，这是 selected 的意思。还有你开手术是selected， 就是选择去开还是不开，有些是紧急。
When our patients are discharged, whether it be to home or to another facility, another thing that we do as nurse practitioners is make appointments for the patients. They need to be seeing their cardiologist within about 2 weeks after their discharge.
他们会帮病人预约医生看出院之后什么时候回来看医生。
We also have them come back and see us,
也会来
as long as they
他
don't
的
live a real far distance, for an incision check to make sure everything is going okay after the surgery.
看他的开刀这个伤口怎么样，会来看他们的。
But we do make sure that they get really close follow-up. If they have outside physicians, we send all their records to them so they are aware of what happened while they were in the hospital.
就是他看其他的医生的话，他这个档案会寄到那个医生那边。
And after they've seen us in the office after the 2 weeks, then if everything looks fine, then we rely on the cardiologist to do the long-term follow-up for any testing they need in the future, medication management.
就是2个礼拜之后回来看他没有事的话，病人就以后就看他的心脏医生的药啊怎么样，都是心脏医生去给的。
So we do once a week. The nurse practitioners run the post-operative clinic. We also see patients that, since there's wounds involved with their incisions, we do see some patients with wounds that need to be cared for.
因为是开刀嘛，这个伤口，有一些病人的伤口就需要多一点照顾。
So we do the care of external wounds and leg wounds after surgery.
他们就是照顾他们的伤口。
Is there any specific questions or anything?
什么问题？
Interested in that I didn't cover?
什么问题？
Just to clarify, this advanced practice nurse is a very valuable member of the team because we are an academic teaching facility and our doctors are all over. This is the one person the nurse relies upon to communicate with the doctor. This is a very important person.
他是工作是很重要的，
Their office is right here on the
医生
floor.
就是时常跟他们联络的。
So if there's a problem, the nurses just walk in and can ask us questions. So we are very available. And that is a good point because the surgeon is all day in surgery. We also have fellows that train under the surgeons and they're all day in surgery. So they're usually not available unless it's an emergency.
因为这边就是学校医院，所以一些医生可能有很多学生的，他们就很忙的，所以他们的工作是很重要。很多护士就问他们。
You just work in this floor or many floor?
Just this floor. If we have,
他只是在这个
if
这
there's
一层楼
if
做。
the floor is full, or we sometimes get patients on another floor, but that's
Always this, yes.
This is the main post-cardiac surgery floor, other than ICU, because we do have a cardiothoracic ICU.
他即便就是开完手术，心脏手术就是来这一边住的。I can get another one.
Yeah, it's a CVICU, so cardiovascular or cardiothoracic ICU, CTICU.
What's the difference between?
Intensive care with 24-hour nursing at the bedside. This is team nursing, not as intensive.
它有两个部分，开完手术也有2个部分，一个比较危险的，一个护士就在旁边，这边呢就是没有这么 sorry， 危险的，所以是他们来这个。
We do have a good team along with the nurse practitioners. We have a social worker that works just primarily with our patients to work on discharge needs. The cardiac rehab nurses that assist the patients with their activity, walking, doing stairs, things like that.
外科这个是心脏外科。
对，但是他有他呢，有社工啊，也有 rehab 的 nurse， 康复。
Yeah, that cardiac rehab nurse is very important.
康复的护士也很重要。
ICU 好了以后再回来。他们这应该有没有各管师？应该也不是每个都介入吧？哈，他们心脏外科应该有各管师。
就是刚刚那个。
刚那个是这边。
不是弟弟是面积。
为什么
？Not every, let's ask another. Not every patient has 就是 case manager. Before we just talk about the AMI and the CH.
Every patient is eligible for a case manager, but they may not need it. So it really depends on what it is that they need. Those two nurses before, Janine, they see every cardiac patient, okay? But they may not need a whole lot of intervention from them. Yeah.
Every patient has heart disease has order sheet.
不是每个人都需要。
Every disease in like a heart has order sheet or no?
Order sheet, yes, everyone, yes. Remember in section 2, in the very beginning, in section 2, she gave you 4 sets of order sheets.
Yeah.
So you either had an acute MI, a non-acute ST, a non-elevated ST MI, and then there was one for angina, and then something else, which I can't remember. So those are 4 different sets of order sheets. And then if we had individual problems, I would call Janine and say, so-and-so's having chest pain or something, and Janine would come in and evaluate and write orders if needed. Yeah.
The order sheet is in the EPIC.
Yes,
Oh.
yes.
Just the choice.
That's correct.
Like the DRG,
Yes.
follow the DRG code.
They're based on...
If you quote the code number, they will order sheet will out.
I don't know exactly how you pull up your order.
Like for ours, we use a post-operative order set.
Yeah.
So you just type in Cv post-operative
Yeah,
order set.
I don't think you type in GRG 430 or
And
something.
then all the
No.
order, and then you can click on the ones you want. So we make sure all our patients are on aspirin, beta blocker after surgery.
Yeah, they're automatically that way, and if you don't want them, you have to unclick it. Yeah. Yeah.
So 所有的疾病都有 every disease almost has order sheet.
Everything is based on research. So all of these order sets are based on research that showed results, and that's right.
In the beginning, maybe just development the
Right.
most disease. Oh, this is large population of the disease.
It's taken us a while to build it in EPIC, yes.
Yeah.
So it is based on like order sets or diseases. Yeah, DRGs.
The most population of
That's
disease.
correct.
Yeah.
That's
刚开始
correct.
可能就是发展比较多的，
Yeah.
然后再慢慢发展少一点。
Yeah. You're going to meet up with Connie this afternoon, and Connie Geary will talk to you about EPIC and how it was built. Yes, because it took several years.
上午都是看那个电脑，怎么样去做，怎么去做。你要不要问他？那个。
你没有问他
Is it here? Yeah, okay.
We have a question of the overview. So when the patient come in, they don't come to this floor.
No,
OK， 不在这边。
they come to the ER.
对，就在紧急那边先，然后对，然后刚才2个 ，so the first two, Barb and
Barb and
they
who
will
was
they
here?
will
Cindy.
evaluate. They will
They
evaluate.
see you after they've already upped here. They don't see you in the ER. Now, Janine might be in the ER because it's a cardiovascular service. So they go wherever the patients are.
You go where?
Yeah. Yeah.
For the most part, though,
our
our patients are coming in for elective surgery. So that the day of surgery, they come from home,
OK，
they have their surgery, they go to the intensive care unit after surgery.
所以就是选择开刀的话，不是紧急的话 ，so it's still intensive care unit when selective surgery. OK。
Yep.
Yeah.
OK， 所以都是去紧急病房，不是 emergency，是 ICU。
So meaning that they're not having an active problem, they're not actively having a heart attack or a problem like that. We do though, we talked about this before, get a fair amount of patients that are transferred from outside hospitals, community hospitals, that will sometimes be up here before. I have one today, he's going to have surgery on Wednesday. So we're getting all his testing done while he's here. He was having an active problem, he was having heart failure. So we're working him up, and he's going to have surgery now on Wednesday.
So that patient directly come to this floor?
He came from another hospital, yes. He's
Yeah.
not sick enough to be in the ICU, so we have him up here.
哦，所以他也是不是很病的，他会来这边，先进这个。
如果比较严重，就来修这样。
And we have one APN, advanced practice nurse, who works out of the CT ICU, and we have another one who works here. You know,
There's 3 of
and
them.
there's 3 altogether, and you cover
3 up on
anybody.
this floor.
Right, yeah.
CT nurse.
Yeah.
I don't know what's the-
Cardiothoracic ICU. We'll take you there on the tour. Yeah.
Anyone that's had surgery of the chest,
Yeah.
heart, lung.
Our transplants, our cardiac transplants and our lung transplants go
移
there.
植这个器官移植。
how long the patients will accept the surgery?
How long are they what?
The patient will receive the surgery, operation.
Mm-hmm.
Yeah.
How long are they in the surgery?
Yeah. And the patient, he stays how long?
In the hospital?
Yeah.
Typically for like a bypass or a valve, the average stay is 5 to 7 days in the hospital.
7.
In total, yes, 5 to 7 days.
Bypass.
Bypass or valve, or a lot of times they'll have a combination of procedures, bypass and valve replacement. If they're doing well, most of them are just here 5 to 7 days in the hospital.
总共
另外一个医生转过来整个的
5到7天而已。
他是评估需要手术费。
And how soon can evaluation the patient need an operation or not? Because how to in emergency you judge the patient need an operation or not?
Oh, okay. When they have, say, a heart attack or something, and it's usually the cardiology team that will follow them, and they'll have the CV surgeon see them as a consultation. So they will decide if surgery is needed immediately while this hospital stay, or if they can stabilize them with medical therapy, have them go home, and then come back for surgery.
Oh.
That happens a lot too. They'll come back.
他是说他马上会先处理，如果不是很急，先处理这样之后再来开刀。
This is all telemetry up here, but most of our hospital now is telemetry.
Yeah. All of our beds in the hospital can be telemetry. This floor, every patient is pretty much on a monitor all of the time. On some of the other floors are only maybe 5 to 10 patients that are on a monitor out of 40. You know.
We have the capacity for any bed to be monitored.
但是那介绍那台那个医化车是不是那个？它不是
It means has EKG monitor in the station. All the
Yeah. Did you see that? We'll take you on a tour.
Yeah, I see.
Yeah.
他是说的是 EKG 的 monitor.
24 hours a day.
像那个 Just choice patient, not all patient need that.
Not all of them need it. No. So I'll make copies of this for you. All right. Ginny, do you want to send in who's up next?
Okay.
Because otherwise I'll start you on a tour of the unit.
Thank you.
Thank you. 你有没有去洗手间啊？你们？
Okay, we're going to tour the unit and then, yes, ladies' room?
Yeah.
Yes, please, go to the ladies' room. We only have 20 minutes to tour the unit.
North Carolina can see in the website. We can see in the website.
Yes, you can
Yes,
see it.
yes.
I had sent you that information.
Yeah,
Yes.
that'll be in there, and it goes through all of the therapies that we try to follow. And when Sarah's in the hospital, her job is to identify the patients who have heart failure. And one of the things that she does is she takes care of fulfilling the core measures. She makes sure that certain things are done with this population. Do you want to talk? She's going to talk a minute about these core
她就
measures.
是医院住院病
Hi,
人部
I'm
长。
Sarah. I educate the heart failure patients, the cardiology and internal medicine patients that are admitted to the hospital.
她就教医
I'm
院
going to talk to you a little bit about the core measures for heart failure and our documentation of data.
她是主要就是记录他们。
Core measures are guidelines that were formulated to assure that patients were receiving excellent quality of care. JACO and Medicare
指标
developed these best practice
病人所接受到的
guidelines
照顾。
along with using the guidelines from the Heart Failure Society. These guidelines are for the heart failure patients that we encourage medical providers to follow, and then there are certain things that they are to document in the patient's medical record.
可是他们要写下来的，他当
There
然
are
指标
4
要
things
跟着做。
that we look for especially.
是呀。
That an ACE
inhibitor or an ARB is prescribed for a patient with a left ventricular systolic dysfunction of less than 40%, that the systolic function is documented on each admission in the chart. They don't have to do a reassessment of the systolic function, but it needs to be documented somewhere in the chart. Complete discharge instructions for the patient, which includes medications, diet, activity, smoking cessation, and follow-up visits. And also for the patients who are smokers, smoking cessation should be completed. If there are any contraindications to these therapies, as far as the medications, it needs to be documented in the chart. Otherwise, we will get docked for not having good follow-up and following the guidelines.
They don't understand docked.
Okay. We'll get penalized. We won't receive reimbursement if certain things are not followed.
就是美国很多餐务所讲的，他都
Sorry.
Reimbursement 是怎么解释 ？Reimbursement.
Yeah, reimbursement would be affected, that's correct.
你不要他们
And when she used the word JACO before, the Joint Commission, that covers all hospitals that receive federal funding, which is most American hospitals.
他就是钱方面啦，所以就是 receive funding from who?
The federal government.
哦，政府有给他们钱
And
的，
then
他们就
Medicare provides on the state side.
他们所要跟随的指标，就是因为政府给他们钱。然后另外一个保险，政府的保险 Medicaid 也要 follow 那个指标，那个 Medicaid 才给他们钱，否则他们就拿不到钱。
Now, we also use, for heart failure, we use a similar data collection tool like the
Is it
acute
here?
MI, yes, it's in
Okay.
here, that the acute MI nurses use. You have a copy of it in
Yes.
here.
Oh, before?
Yes.
Yeah.
Okay.
Acute
Oh,
MI
okay.
for the two nurses in the first.
Heart
case.
failure
在前面
uses
在前
their
面
own.
算算，在前面 second or third，在前
Is
面
it, where was it? No, but this one's different. This is for heart failure. Right here. Okay. And we also, heart failure also sends this data to the University Health Consortium. And then we strive to be above UHC for our data. Okay. So the tool just goes through various things that need to be documented in the chart, and especially at discharge.
那个他所有的东西都要写下来。
Right.
要是
It
拿
starts,
钱
with the ethnicity and the birth date. Talks about the patient's
资料
discharge
他本人资料
disposition,
医生
whether they were discharged home or to a skilled nursing facility.
他回家还是
Rehab,
到其他地
home
方
health.，
要去康复。
And then we get to the part that discusses the left ventricular systolic function.
左边心脏
And then
心房
if their
那叫什么
ejection fraction was less than 40%, there's a section here that discusses the indication for ACE and ARB, and if whether or not they were discharged on one, and if they were not, it needs to be documented why.
What else that?
And then
Wait, hold on.
What do you guys understand? I didn't follow.
Everything is documented in the medical record. In
Right,
Epic.
right.
Right. So if the left ventricular systolic
and then?
function is less than 40%,
Uh-huh.
they need to be discharged on an ACE inhibitor or
ACE
an ARB.
inhibitor or not.
Okay.
You guys know what is right. I don't know.
Yeah.
Or,
You知道吧？
or the
the
ACE
in-
inhibitor.
Yeah.
你知道吗？
Angiotensin receptor blocker.
你知道吗？
And if they are not, it needs to be documented a reason why.
like the low blood pressure.
or if they have renal failure.
Allergies.
Yeah.
Yeah.
So there could be a reason why they're not on that medicine.
And then the final part just talks about the different discharge instructions that should be given to the patient and in the chart. Okay. And then once this data it's entered into a database like the other acute MI, and charts are formulated that show our how well we're
资料放
doing.
进去之后，就看看医院做的怎么样了又。
For the majority for heart failure, we're pretty much at 100% for everything.
心脏
Our physicians,
病的话
our medical
100%
providers are actually been shown to be very compliant with these core measures and documentation.
他们就跟着那个指标去做。
There is one area
只有一
that there
方
was
面
a large
说的
dip in
很不好的话，就
2006
是
because of the electronic, the new computer system.
就这位新的电脑
So
安
you
装
can
的
see
时
how
候，
we strived at 100% along the way. Okay? Any
这
questions?
个新的电脑装的关系了。
because the new epic installation.
The outpatient people got Epic 2 years earlier than inpatient. So in 2005 or 2005, the
门诊先有
outpatient Epic started.
门诊先有这个 epic computer system。
I'm going to hand you back to Mary, who's going to finish talking to you about the rest of our heart failure care.
We kind of skipped over the first few handouts in this section, and there is an order set for heart failure.
有 order set 医生写的，有心脏 order set。
Not all of the physicians use it, but it does exist.
但是不是每个医生做都用，但是有
And then there is a care map in there.
有照顾的 mapping。
After the order set, there's a care map,
order set 之后有个地图，
which was used at one time but is not currently being used.
他
But
们
I
现
put
在
it in
不
there
用的
anyway for，you.
他们现在不用。
为什么？坏。
care map。 Why don't you use?
We used this before we transitioned to the computer system. So a lot of what is on this pathway, this care map, has now been implemented into Epic.
It's in the
已
order
经在
set.
这个
Yes,
电脑
it's
里
been
面 epic 这个
formulated
电
into
脑
the
里面。
order sets in Epic.
We can
So,
see.
so that's the reason why you had asked for care maps, and I could only provide you with old ones, because we're now modern and everything's in the computer.
We can see that.
Yeah,
It's in there.
you can see
这
it.
些是
Yeah.
在电脑里
Yeah,
面
it's in there.
care map
And you'll see it this
Order set.
afternoon.
Yeah, so that, I just want to make sure that you knew that was there.
So all the documentation almost in the EPIC system.
Yeah, we're
Right.
giving you everything.
Probably more than you want.
I want to ask how to assessment the left ventricular systolic
他们的
function.
分数，
Echocardiogram.
他们是
Oh,
Yeah.
for echo.
Yeah, echocardiogram is the method most used to determine the systolic function.
中心的
function.
measure
Right, ejection fraction.
两种。
Right. So everybody 40% or less
不止指标，他们的分数
needs to have all those core measures
这个是
documented.
什么
That's kind of, that's
But
a
that's the
cutoff point.
diagnosis of CHF. In order to have CHF, you have to have an LV function less than 40%.
Right. So they're in the hospital, they get their core measures, the data gets collected by Sarah, the patient gets educated by Sarah and the staff nurses, and then they're discharged. And they get the same kind of discharge summary that the last, who was it that had that? Cindy had. It's all the same in EPIC, the same discharge instructions, the medications, instructions, appointments, it's all the same for
他们
each,
是
for
说
every
因为有
discharge.
个电脑了，所以他出院的表啊，所写的东西都是一样的。
I don't have a
不同的
specific
人
one in here,
都
but
拿
it's
的
all
都
the
是一
same.
样的，因为
And then the patients are generally discharged, they can be discharged to a couple of different places. One, if they're one of our heart failure, heart transplant patients,
they'll be referred back to our practice for follow-up. And then also, Sarah refers patients from other cardiologists and internal medicine doctors to the nurse practitioner clinic. But in any case, heart failure patients get usually a 2-week follow-up. So 2 weeks after out of the hospital, they come to the doctor or the nurse practitioner.
2个礼拜回来看他们，还是心脏医生
full follow up in the 2 weeks. Follow up the patient.
Who follows up with the patient in 2 weeks?
They'll either come to me, nurse practitioner, or they'll go to their regular cardiologist or our heart failure cardiologist. But usually patients, and sometimes it's only a week or a few days depending on the patient, but in general, what you say in general, 2 weeks, they're coming back to the outpatient side to be evaluated again. Okay.
That's a critical factor to keep them out of the hospital. Remember Mary said 30 days, if they're readmitted, we don't get reimbursed. So having this clinic, having the nurse practitioners run this heart failure clinic has been a big success for us.
他们最主要的是不让病人30天之内再回来有心脏病，所以他们所做的2个礼拜去 check 他们呢是非常好的，所以病人不会，大部分不会30天就来走回来。
So when they come to see me after the hospital, I will go through with them their medication list that they got at discharge.
他来见他的时候看他吃什么药。
I'll make sure that that is what is in EPIC and that that's what they're doing. So that's the medication reconciliation, as we call it.
在电脑上面所写他们要用的药跟他们拿回去的对不对一样。
And then we'll go through, I'll do a history and a physical on the patient.
也是看看他们的历史。
And hopefully they're feeling better.
希望他们是比较好一点。
Okay. We do re-education, so we instruct again on salt restriction.
在教育他们不要吃太多盐。
Fluid restriction.
食物不要有什么食物不要用。
We do stress the importance of the daily weights.
每天I don't understand that.
What we ask our heart failure patients to do is every morning you get up, go to the bathroom, step on the scale and weigh yourself.
帮助每天早上教育病人每天早上去量他们自己多重。
Very important.
很重要的。
One of the simplest things heart failure patients can do to help themselves.
这最简单的东西他们可以帮。
So what we want them to do is not only weigh themselves, but write it down.
量他们多重写下来。
And if they gain more than 2 pounds,
那他们就是重过2磅的话
in 1 to 2 days,
1-2天重2磅的话
or more than 5 pounds in a week,
1个礼拜重5磅的话
Do you know what those are in kilograms?
in kilograms,
你们用 kilogram
let me tell you.
只有美国还是用磅
What's 2 pounds is what, a kilogram?
2.2 pounds.
2
公斤呢？2公斤多吧。
So 5 pounds is 2.2 kilograms. So if what we're looking for is water weight.
就是他们水肿，就是重量是水的来的。
Okay, even if they feel okay,
虽然他们觉得没问题
we want them to call us.
但是他们都要知道。
And then we'll ask them questions, and depending on their answers, we may adjust their diuretics over the
我就
phone.
会问他问题的啦，就看看他的答案是怎么样，他的食物会改。
It's a very simple thing to do, but a lot of patients don't do it.
但是很多病人不做。
不量体温的体重的。
So we always are encouraged them to weigh themselves and keep track of it.
他们鼓励他去量重。
And to call us when they see the weight gain. The reason it's important that they call us early is because it's so much easier to take off 2 or 3 pounds of water.
很容易2-3磅是很容易拿去。
Than to take off 10 or 20 or 30 pounds of water.
20-30磅就比较难了。
In that case, they're going to have to come back into the hospital, get the IV, and get the IV medicine.
就是20-30磅的话，他只有回来医院用点滴用药从点滴里面。
So during the nurse practitioner visit, we go through the medications. We re-educate them on the salt and fluid restrictions and the daily weights.
他2个礼拜后回来看他们，主要就是看看他用药有没有用得好，然后再教育他们食物方面不用太大盐。
And then what we do is we look at the medications and we see if their medications are optimized at the best doses.
看看他的药是不是用够药。
In some cases, patients are started on new medicines in the hospital at the very low doses.
很多时候医生写的正常是最低分量的。
And we always tell patients that we have to start the heart failure medicines at low doses.
从最低的开始。
And we start low and we go slow.
慢慢的加上去。
So at the nurse visit, we're going to assess their fluid status, see if they have water on them.
看身体里面有多少水。
And if they are not fluid overloaded,
不是很多水的话
and their blood pressure is okay,
血压好
and their heart rate is okay,
心跳好
and they're not dizzy or lightheaded,
也不会晕，不会头晕
we'll consider increasing the beta blocker.
然后就加那个 beta blocker.
And there are target doses to get to for beta blocker.
有一个目标的用 beta blocker.
And the ACE inhibitor. So we titrate up both of these medications. In some cases, we'll titrate up the ACE inhibitor first.
就是看这2种药，看看分量够不够了。
And once patients are at a goal for their ACE inhibitor, we'll start increasing the beta blocker.
就是一个够的话，另外一个是 increase.
But it's not.
Wait. I'm not familiar with the medicine's name, so she's asking what do you mean by
Toprol, metoprolol, Coreg, carvedilol, atenolol. Those are beta blockers.
他是说 beta blocker 怎么样？
就加，慢慢的加。
Okay. So one of our jobs is to adjust these
Are
medications.
those meds on the list where in this chart?
I think they might be in the order.
They're probably, they're in the order set.
Okay, so the medication names are there. Okay.
Beta blocker, ACE
Page
inhibitor.
These are the meds. Yes, these are the meds. I just want to bring to your attention, we're going to have to leave from this room to go right to lunch because we only have the room till 1 o'clock. We'll have to do the tour another time. Okay.
我们要去吃 lunch， 午餐了，看医院的其他的时候了。1点钟一定要交了。
So in addition to adjusting the beta blocker and the ACE inhibitor, of course, we're also looking to see if they're fluid overloaded. Sometimes patients come out of the hospital and within 2 weeks they're almost back to where they were. If that's the case, we can adjust their diuretics, their Lasix, furosemide in the clinic. We can also give them IV diuretic in the clinic if we need to.
药都是药啊。
就是那利尿剂，注射的后面。
他说他有时候也给人家注射拉稀释。
Lasix, yes.
We also order blood work. It's important when patients are on the diuretics to monitor the renal function, which is the BUN, creatinine, and to monitor their potassium. So they get frequent blood work to make sure that they're tolerating the
看看他的血
medication.
是怎么样。
Okay, and then when they're done with me in my clinic, they get a discharge sheet. Each visit, they get a discharge sheet from the outpatient clinic, which is different from the hospital.
他们有一个档案，每次看完他有一个档案的，跟医院
And
不同。
it should be in there.
应该有。
So this is the order set. That's the care management. Core measures. Oh, this is in your binder, and patients get this in the hospital.
在后面的。
And sometimes I give that to them
病
again in
人
the
有
clinic.
就是给病人的。
And it's very nice because it goes over. This is different.
They
This
have
one.
you have the
There you go.
copy version.
That's that one.
另一个不是，那个是
And this is different than micromedics. When we learned about micromedics on the chart, it was like,
Yeah, there you go.
this is supplemented.
So this is very nice for the patients. It talks about heart failure, the signs and symptoms of heart failure. It goes over the
这个不是，这个不是，不是在哪里买的？这个是转移，这个是
It goes over the food label. It talks about the high sodium foods that they should not eat and choices that are better for them. That's the page right there. Avoid high sodium foods. These are better. So we review that with the patients.
有新图的就讲了，好像差那个。
It also talks about the medications. Talks about daily weights.
是
So
焦
this is
焦
a
虑
nice
病人
book.
的，一个是焦虑病人
It
的
prints
重
up kind
量
of small, but it's all there. It's really nice.
哦，这边
That's right. That's you got it
是
now.
吗？
And it has a nice picture. We got this
还
copy
都
on
是
here.
说就是
So we can
比较
refer
小
to，this
比较
when
小，
we're
但是
teaching.
都
Tell them
就
this is
是
their
复
left
印给你
ventricle.
们，就是
So we use this as a little teaching tool
就
also.
是教育那些病人的。
Okay. And then when they go home from my clinic,
他们离开的后
we
面，
print up a discharge sheet from Epic.
他会印出来出院。
I thought it was. I
这
saw it in the line.
个台队，这个台队。
I know a few in my had a discharge sheet.
对对对，
No, it's from the outpatient attendant that we made for heart failure.
早就是这个。
对对对。
Do you have it with you that I can copy for that?
No, 这边没有 discharge sheet。
The doctor sure was in there. I looked over her binder when she was gone.
Because Barb and Cindy shared like a check off, yeah, it was a grid. Barb and Cindy gets a grid for nursing.
No.
No? All
That's
right.
different.
Could you get that to me, Mary, and I'll make copies
Yeah,
for them?
yeah, I can pull one up. I'm sure, I'm really stymied because I'm sure she stuck it in there. Sorry to take the
Is
time,
this
but.
Is that it?
Yes, okay, I found it. It's kind of in the wrong spot, I think. Okay. So what we do is, they'll get this printed up. It has our office phone number, our office fax number. It gives the signs and symptoms of when they should call us.
就是给他们的电话啊，什么时候要打电话给他。
It reinforces the low salt.
再想不要吃盐。
We put in their low cholesterol. We don't stress that much. It's mostly the
但
salt
是
and water.
最重要，他怕他们用太多盐，也是
And then we have the option of putting in the food restrictions, different values.
不同的。
That's right, that's it.
这张嘛，这张好几地方。
So for most people, we tell them to keep their fluid at 6 cups a day, or 1.5 liters.
食物不要吃的太多，6杯，我不知道你们怎么量啊，随便只有6杯的食物而已。
水还是食物？
食物，6 cup food, right?
Right, all fluid,
食物
all fluid, water, coffee, juice, everything like that, all fluid,
常不
for 24 hours.
Oh no，液体也不是食物，液体
All
no
fluid.
液体。
And then under the plan of care, we'll type in the instructions. It might just say continue the same medications. If there are medication changes, we type them out so that they understand. If we order blood work, we write down the blood work they're going to get.
他会写下来，要是有抽血啊，怎么样，他会写下来。
So whatever our plan of care for that day is, we type it down for them. So they have the written instructions.
他们会拿着他的
So every time they
写
see the
下来的。
doctor or the nurse, there's
Right.
a discharge instruction. They have a handwritten document to take home with them.
他们出院离开看完病一定要写下来，他们回家做什么。
And some patients even keep a folder of these.
一起。
Not very many, but some people do. They like to keep a track of what's going on. And then we'll always put down when they should come back. What we'll either give them a specific date or we'll tell them 4 to 6 weeks or something like that. They will
然
always
后
get a
看看他什
follow
么
up.
时候回来看他们。
And for patients that I see who have problems with fluid or, compliance is an issue, sometimes we see these patients every week, sometimes twice a week.
就是他水肿的很厉害，就每个礼拜看哦，或者1个礼拜2次都要他回来看病。
And there are some patients that we've had who have had to come every week and get IV Lasix.
而且有些病人每个礼拜来就点滴 Lasix， 你知道 Lasix 是什么吗？
And it's been able to keep them out of the hospital
然之后他是这样子，他就不需要住院，
at least for a longer period of time
长一点时
than
间不用
otherwise.
住院。
So this has been critical to our success in our case management of heart failure.
他们很重要，很重要，他们成功。
门诊的花卉是另外的还是包在一起？
I have to cut it
当然
short
另外的。
now because we have to get to lunch.
Okay.
All right. So Mary, you are welcome to join us for lunch so that they can
对呀
answer
那要是
questions.
钱
Karen will stay with you. That way,
Okay, there's a lot, do you do transplant in Taiwan? Yes, there's a whole part on transplant in here too.
yeah. So we bring her to lunch, and if you can make it.
Okay.
And then you can ask questions at lunchtime. Okay?
Okay.
We have to get going. I'm trying.